Good morning, Dr. Pradeep Talwalkar from Raheja Hospital, Mumbai. On every 14th November, all over the world, it is celebrated as World Diabetes Day. पूरा दुनिया में वर्ल्ड डायबिटीज़ डे सेलिब्रेट किया जाता है। इसका मकसद ऐसा है कि दिस डायबिटीज़ इज़ अ लाइफ लॉन्ग डिजीज़ एंड द पीपल मस्ट नो दैट दे हैव टू कंट्रोल देयर डिजीज़ थ्रू आउट देयर लाइफ to prevent complications, to have a good quality of life. So, several programs across various formats using various media, the audio, the visual, the virtual, the physical, all these medias are used, and experts in the field of diabetes help this day to spread the knowledge about diabetes to the diabetic patients, to their near and dear ones, and to the community in general. There are lots of misconceptions about diabetes in mind of lay people, and these misconceptions are one of the stumbling blocks which interfere with a good control of diabetes. So on this particular day, through various programs across various cities and countries, the experts gather together and independently talk with the people with diabetes, spread the knowledge. This knowledge should be helpful for the community, for the nation, to prevent diabetes as long as possible, as far as possible, to diagnose diabetes as early as possible, so that the treatment is started before even the minutest of the minute complication is developed, and to treat diabetes as strongly as possible, as appropriately as possible, so that the blood glucose is very tightly controlled, appropriate for the age of the patient and the other associated conditions, so that the complications will be prevented. If one prevents the complication of diabetes, the longevity of diabetic patient improves and approaches the longevity of life or a lifespan in a normal population. But what is even more important than the lifespan or the longevity is the quality of life. In today's fast-paced world, with nuclear families becoming the norms, there is no help available for elderly diabetics, and they have to be independent as far as possible. And in order to be independent, their organs should work effectively, and for that they must have a tight blood glucose control to prevent complications which increases their dependency. Say for example, paralysis, heart diseases, eyesight problems, all interfere with the independent character of the diabetic patients, and if he has to be independent in his old age, he has to control diabetes. If he has to control diabetes, he has to know about the diabetes, he has to have an actual knowledge of diabetes, remove misconception in the mind, and this is the whole idea of celebrating World Diabetes Day. Even those diabetics who have conquered their diabetes successfully join to give advice based on their own experience, and that is also helpful. So everybody comes together to spread the knowledge of diabetes, to remove misconceptions in the minds of community, to improve the quality of life of not only the patients, but in the long run, the quality of life of people in the nation, and improve the strength of nation. So let us come together and celebrate this World Diabetes Day in the right earnest. Dr. Joslin, almost about 100 years back, made a very important statement. He was the pioneer diabetologist who knew the importance of patient education. His statement, made in 1925, said that a diabetic who learns maximum about the disease will live the longest. On this happy note, I end my World Diabetes Day message. Thank you.